Hi everyone, Dr. Lisa Kaufman from Geriatric House Call Dentistry here with Dr. Anshu Bansal from the Dallas and Fort Worth area. And one of Dr. Bansal's strengths is in treating patients with sleep apnea. I don't know a lot about sleep apnea. I know it's a huge issue and I know that a lot of people have it, especially as they age. So tell us a little bit about that and how you treat them in the home.
So sleep apnea is a condition that is least recognized and most prevalent. It is more prevalent than diabetes. And it's not diagnosed unless you go and specifically ask your physician. They will not even check you for apnea. I am very passionate about apnea just because when I see younger people and I ask on their medical history, they have diabetes or pre-diabetic or pre-hypertension, borderline, and they're like, I don't know why, but my weight is increasing. I don't know how to control. I'm doing everything. And I'm like, go get yourself checked for sleep apnea. And they were like, I'm young, I can't have sleep apnea. So that's a huge myth. Sleep apnea is not just for the older generation. It is for the newer, younger people who are so stressed with today's lifestyle. They're not getting enough sleep, and whatever sleep quality they get is very poor. That's where apnea comes. I would like to offer you an apnea treatment at your home. It's very simple. I can come, if you don't have time to travel to my office, I can come and visit you, take impressions. The only thing we need would be a sleep test. And if your PCP is not ready to do it, I can do that too.
Wow.
I can provide a home sleep test, read the results, and have a physician make a report, and then fabricate a custom appliance that is unique to you. And there are only two ways to treat sleep apnea: either a CPAP machine, not a very happy thought with all the cumbersome, or an oral appliance. And it works wonderfully, works as good as a CPAP machine. Think about it, give it a try. If you have any of the conditions, contact your PCP, or you can call us at 866 at Geriatric House Call.
So let me ask you a question. What percentage of elderly people actually have sleep apnea? And you're talking about diabetes. Is it also related to any other issues?
Everything. So as we grow older, apnea starts pretty early, but nobody checks it. And as we grow older, depending on your family genetics, if you're more prone to high blood pressure, diabetes, dementia, Alzheimer, everything has been linked to apnea.
How do you know? Like, is there signs of sleep apnea? I mean, you don't sleep well, but what other signs could lead you to believe you have sleep apnea?
So, like everybody knows, snoring is the biggest.
Oh.
But that usually comes with obesity.
Okay.
So higher weight will lead to snoring. Now we have a lot of skinny ladies who are very tiny, petite. They have apnea. And how do I know it? Very young, starts on high blood pressure medication, super anxious, cannot sleep.
Can they fall asleep or they can't stay asleep? Or is there even a...
No, sometimes they just cannot fall asleep, or sometimes if they sleep, they sleep for like half an hour, then wake up for a couple of hours, then sleep. So when they tell me a pattern like this, I know they're not sleeping well.
Wow.
So the brain is just not getting signal that the body is asleep. So the brain is functioning. There is no rest for the brain.
Wow.
And then when that happens, the hormonal cycle in the body is jacked up.
Wow.
Because every cell in our body has a circadian rhythm. So even the cells have a morning and a nighttime.
Wow.
So that is the reason I'm very passionate about sleep apnea. Please seek out.
Wow. I mean, this is such huge news. I mean, to have somebody in your area that could come to your house and to actually check you if you're not sleeping well, this is amazing. So if you have any of the issues described by Dr. Bansal and you feel that you might have a sleep issue, then you should be checked for sleep apnea, and she'll be happy to come to your house. And if it's a loved one, an elderly loved one who's snoring, they may be obese, they have diabetes, all of the issues that she listed that could contribute to having sleep apnea, give Dr. Bansal a call for a consultation at 866-686-4423, and she will call you back. Thank you so much for that.
Absolutely.